Okay, so we're going to evaluate the shoulder. First injuries that we're going to talk about are called glenohumeral instability. So you can have instability anterior, so in the front, posterior, in the back, or inferior, in his armpit. Or you can have multi-directional instability, which means that it's unstable in more than one of those directions. So the first test that you're going to do is called the load and shift. And you grab a hold of their shoulder and then you're trying to shift it forward. So you're grabbing the humeral head and you're trying to shift it forward or shift it back. If it went farther forward or farther back, then they have instability in that direction. And then the second test we're going to do is the anterior and posterior drawer. So lay down. So you're going to do it like you would the knee. You're going to hold on to their shoulder and then you're going to do kind of the same thing you just did with the load and shift, where you're going to pull forward on the head of his humerus and then push down for posterior drawer. So it's just a laying down version of the last one. And then sit back up. And then we're going to do a sulcus test. So if he sits up nice and straight, then you grab a hold of his elbow, sit up straight, grab a hold of his elbow and then you pull down on it and you would see a sulcus. So you would see right at his AC joint, this would get sunk down. And that means he has inferior instability. Okay, then lay back down. And then the next one is called the clunk test. So you hold them like you did for the drawer and you externally rotate them and then you're trying to make a clunk. So you do a circle and you're trying to make the head of his humerus grab a hold of his labrum, and if you feel a clunk, it's like a meniscal tear in the shoulder. Okay, you can sit up. Okay, and then spin facing Derek. So the next one's called O'Brien's and it's checking for a labral tear. So if he sits up nice and straight, sit up, and we take him over into horizontal adduction, point his thumb down, and then have him push up here, push up. If that caused him pain, then we would have him open up his hand, put his palm up, and then push up, and that would check for a rotator cuff, labral tear. And then lay back down, or you can stay here, actually. Okay, the next one is an apprehension test. So we're checking to see if we think he dislocated his shoulder. So we take him back into external rotation. This is the dangerous position for a dislocation. So we're trying to mimic that motion, and if that bothered him, then he has a positive apprehension test. And then you can do a posterior, so lay on your belly, or back, stand back. Okay, and then you bend their elbow, and you would have them off the table, so like his shoulder is off this bench, and I would just push down through his elbow, and see if I can get him to go back again, and that's a posterior apprehension test. And then Job, or the relocation test, goes along with an apprehension test, which I gotta get in better position. I keep him here, and then I'm applying. So if he was a positive apprehension, then I would do Job, or the relocation test is what your book calls it. You push down on the head of their humerus, and then you can take them farther into external rotation. Okay, pause that now.